Last month, a 68-year-old patient walked into my clinic smiling. He drove himself there. He exercised 3 times a week. He told me he felt healthy. No chest pain. No severe headaches. No medical emergency. In fact, he almost canceled the appointment because he didn't think anything was wrong. But when we checked his blood pressure and ran a few tests, the results told a very different story. His blood pressure had been dangerously elevated for years. His heart muscle was already thickening. His arteries were becoming stiffer. And most frightening of all, he was at significantly higher risk for a stroke than he realized. The shocking part? His body had been sending warning signs for a very long time. He simply didn't recognize them. And unfortunately, he's not alone. Every year, millions of adults over 60 live with uncontrolled high blood pressure without knowing it. They feel mostly normal. They continue their daily routines. They assume the small changes they're experiencing are simply part of getting older. But those small changes are often the earliest warnings that the cardiovascular system is under silent attack. Before we begin, take a moment to subscribe to the channel and turn on notifications. Here, we share trusted health information specifically designed for adults over 60 who want to stay independent, active, and healthy for years to come. And while you're watching, I'd love to hear from you. Tell me your age and where you're watching from in the comments below. It's always inspiring to see viewers joining us from around the world. Now, here's what most people get wrong about high blood pressure. They believe it announces itself loudly. They expect severe headaches, crushing chest pain, dramatic dizziness, or symptoms so obvious they can't be ignored. But the reality is very different. The most dangerous hypertension often produces almost no obvious symptoms at all. That's why doctors call it the silent killer. It quietly damages arteries, strains the heart, weakens the kidneys, and affects the brain while allowing people to believe everything is fine. The human body is incredibly adaptable. When blood pressure rises slowly over months and years, your brain begins accepting that elevated pressure as normal. What once would have felt uncomfortable gradually becomes your new baseline. This is why so many older adults dismiss warning signs. They blame age. They blame stress. They blame poor sleep. Yet the real cause may be hidden inside their cardiovascular system. Today, I'm going to reveal 9 silent signs that your blood pressure may be dangerously out of control. These are not emergency symptoms that send you rushing to the hospital. They're subtle changes that most people overlook. But if you recognize them early, you may have the opportunity to prevent stroke, heart attack, kidney disease, heart failure, and even cognitive decline. And make sure you stay until the end because the final warning sign is one that many people experience every single day without realizing it may be connected to blood pressure. Let's begin with the first sign. Persistent fatigue that doesn't improve with rest. Many people over 60 assume it's normal to feel tired. After all, aging naturally changes energy levels. But cardiovascular fatigue is different. This isn't the kind of tiredness that disappears after a good night's sleep. This is the exhaustion that follows you throughout the day. You wake up tired. You feel drained after simple activities. Stairs seem harder than they used to. Walking becomes less enjoyable. Tasks that once felt effortless suddenly require more effort. What many people don't realize is that elevated blood pressure forces the heart to work harder every second of every day. Imagine carrying a heavy backpack from the moment you wake up until the moment you go to bed. Eventually, your body begins to feel the burden. The heart experiences something similar. Over time, the heart muscle thickens because it's constantly pumping against increased resistance. Doctors call this left ventricular hypertrophy. Although the heart becomes larger, it doesn't necessarily become more effective. In many cases, it becomes less efficient. As efficiency declines, oxygen delivery throughout the body becomes less effective. The result is lower stamina, reduced endurance, and chronic fatigue. One patient told me, "Doctor, I don't feel sick. I just don't feel like myself anymore." That statement stayed with me because it's exactly how many people describe the early stages of uncontrolled hypertension. If your energy has gradually declined over months or even years without any obvious explanation, don't automatically assume it's aging. Your heart may be quietly working overtime. The second silent sign is morning headaches. Have you ever woken up with a dull pressure in your head that slowly improves throughout the day? Most people blame dehydration, poor sleep, stress, or sleeping in an awkward position. But in many older adults, morning headaches can be linked to elevated nighttime blood pressure. During healthy sleep, blood pressure should naturally decrease. This nighttime dip allows the cardiovascular system to recover. When that dip doesn't happen, blood vessels remain under pressure throughout the night. As a result, some individuals wake up with a feeling of heaviness, pressure, or discomfort in the head. It's usually not a severe migraine. It's often subtle enough to ignore. Yet it may be one of the earliest signs that blood pressure remains elevated when the body should be resting. What makes this particularly dangerous is that most people never monitor their blood pressure while sleeping. They have no idea what's happening during those critical hours of recovery. If you frequently wake up with headaches that gradually improve as the day progresses, it may be worth discussing blood pressure monitoring with your healthcare provider. Now let's move to another warning sign that often appears long before serious cardiovascular disease becomes obvious. The third silent sign is blurred vision that comes and goes. Your eyes contain some of the smallest blood vessels in the entire body, making them especially vulnerable to pressure-related damage. Many adults over 60 assume changing vision is simply part of aging. Sometimes that's true. But fluctuating vision can also signal that elevated blood pressure is affecting the delicate vessels inside the retina. You may notice occasional blurriness, difficulty focusing, brief visual disturbances that seem to disappear on their own. Because these episodes are temporary, they're often ignored. Yet the eyes frequently provide one of the earliest windows into cardiovascular health. The fourth sign is unexplained shortness of breath during normal activities. Think about your daily routine. Walking through a parking lot, carrying groceries, climbing a flight of stairs, doing household chores. If these activities have become noticeably more difficult, your body may be trying to tell you something important. High blood pressure increases the workload placed on the heart. Over time, this can reduce cardiovascular efficiency and affect circulation. Many people don't notice the change immediately because it happens gradually. They simply begin slowing down without realizing why. They take more breaks, avoid stairs, reduce activity. Adaptation becomes normal. But the underlying problem continues progressing. The fifth sign is swelling in the ankles, feet, or lower legs. Have you noticed your shoes feeling tighter by evening? Do your socks leave deeper marks than they once did? Persistent swelling may indicate that the cardiovascular system is struggling to maintain proper fluid balance. When the heart works less efficiently, fluid can accumulate in the lower extremities due to gravity and circulation changes. While occasional swelling may be harmless, swelling that appears consistently should never be ignored. The sixth sign is frequent nighttime urination. Many older adults wake up once during the night to use the bathroom. But if you're waking 2, 3, or even 4 times every night, there may be more going on than simply aging. Elevated nighttime blood pressure can increase urine production as the kidneys attempt to regulate fluid volume. This creates a cycle that many people never recognize. Poor sleep contributes to higher blood pressure. Higher blood pressure contributes to disrupted sleep. The cycle continues night after night. The seventh silent sign is brain fog. This symptom is often overlooked because it develops slowly. Perhaps you find yourself forgetting words more often, struggling to concentrate, feeling mentally slower than you once did. Chronic hypertension can affect the small blood vessels that supply the brain. Over time, this may influence memory, focus, and cognitive performance. While occasional forgetfulness is normal, persistent cognitive changes deserve attention. The eighth sign is dizziness when standing up quickly. Healthy blood vessels adapt rapidly when body position changes. But long-term hypertension can make arteries less flexible. As a result, blood flow regulation becomes less efficient. When you stand up, blood may briefly pool in the lower body, reducing circulation to the brain for a few moments and creating feelings of dizziness or lightheadedness. Although many people dismiss these episodes, repeated dizziness may signal underlying cardiovascular dysfunction. Finally, we arrive at the ninth sign, the one that surprises many people the most. A gradual decline in exercise tolerance. This often happens so slowly that people don't notice it. They simply become less active. They walk shorter distances. They recover more slowly. They avoid activities they once enjoyed. They assume they're getting older. But in many cases, declining endurance reflects the cumulative effects of years of elevated blood pressure forcing the heart and blood vessels to work harder than they should. Here's the most important lesson from today's discussion. None of these signs alone proves you have uncontrolled hypertension. But when several appear together, they create a pattern that should never be ignored. High blood pressure rarely shouts. It whispers. It speaks through subtle changes in energy, sleep, vision, breathing, thinking, and physical performance. The good news is that early awareness creates opportunity. Regular blood pressure monitoring, healthy eating, physical activity, quality sleep, and working closely with your healthcare provider can dramatically reduce cardiovascular risk. Before you leave, I'd like to ask you a question. Which of these warning signs have you personally experienced? Fatigue? Morning headaches? Brain fog? Frequent nighttime urination? Let me know in the comments below. I read your comments, and your experiences may help someone else recognize a warning sign they were about to ignore. If you found this video helpful, please subscribe to the channel, give this video a thumbs up, and share it with a friend or family member over 60. One share could help someone discover a silent problem before it becomes a life-changing emergency. Remember, your body is constantly communicating with you. The question is not whether it's speaking. The question is whether you're listening. Thank you for watching, stay healthy, stay active, and I'll see you in the next video.